When looking at income protection, we need to determine if the disability is temporary or permanent. So is it an acute condition where the client needs just a short time off work, or is this going to be a long-term claim? We need to try and decide this at the outset because, especially with income protection, we want to case manage these claims as far as possible. We want to make sure that the clients are getting the right treatment, that they are attending treatment, that they're having regular rehabilitation in line with the condition, and that they know that we are monitoring them every step of the way, and that we're also there to assist them and facilitate recovery. So there's generally two conditions in terms of income protection. The one would be, has the condition or injury caused the claimant to lose income? Because if there's no loss of income, then obviously there's no insurability, so we wouldn't be assessing a claim. And the second one is, have they been booked off for the waiting period, or actually longer than the waiting period being the minimum time that they would need to be booked off. And if they satisfy those two conditions, we can pay a claim. We need to find out if the period booked off work is reasonable, because if we approve the claim for a long period, we may not get the individual back to work. We know from the evidence that individuals who are off work for longer periods of time are less likely to return to work. So we need to intervene at the earliest possible time. The other consideration is that we often don't see these claims as the injury or the condition happens. We only get them at a very late submission date or very long into the recovery process, and we've almost lost the opportunity to intervene and get those individuals back to work. I think it's also important to have discussions around which cases we should spend time on and try and assist return to work, and others where we can accept that those are long-term claims and we can focus our energy elsewhere. Once again, with income, individuals may have not achieved maximal medical improvement, but we need to monitor that they are getting the treatment that they need and ask for proof of this. And we need to be mindful, especially with musculoskeletal conditions, of psychological overlays. In terms of access to rehabilitation, we find that some people don't know that certain rehabilitation is available. Depending on the doctor they've seen, they may not have been advised to go for rehabilitation, and we need to step in and show that we care and that we can assist in terms of guiding them to their recovery. An example of a dread disease case study is as follows. We have a 32-year-old male where the policy commenced in 2016. He had a fall and he had a lumbar disc herniation as a result, and he had a surgery in April 2018 for this condition. And the criteria for payout in terms of the policy would be having undergone spinal fusion and decompression laminectomy. So in terms of non-disclosure, the investigation will need to be looked at in line with your particular policies in terms of the time frame from the date of commencement of the policy to the date of injury, and you would need to explain the process to the client. But in terms of qualifying under the benefit, because dread disease is usually as a result of trauma, you would need some sort of confirmation that it was as a result of trauma, which isn't always possible, but as far as possible, you should try and obtain that. And you would also need to have the operation report to determine what kind of surgery he had. And it's usually a partial payment. It isn't usually a full payment for this sort of benefit. With regards to an impairment case study, we had a 55-year-old female where the policy commenced in 2000. So this policy was quite old, and she had lumbar degeneration with radiculopathy. Owing to her age, we could expect that some sort of degeneration could be present, and she opted out of having surgery. So what was important in this case study is that we could not force her to have surgery, because that would be unreasonable from an insurer's perspective and from a client perspective. And we had to assume that she had reached maximal medical improvement at that stage. So for this client, maximal medical improvement would have to be all conservative treatment measures in terms of physical therapy, seeing her doctor regularly, going for regular update of her scripts for her medication. And the criteria was quite simplistic in terms of paying for radiculopathy and changes on special investigation. So In terms of the requirements needed for this claim, we would have to have the radiological reports, like the MRI scan, that would show the lumbar degeneration. And it's important to note for radiculopathy, you need to look at how it's defined in the policy, because radiculopathy is generally not only defined medically, it's also defined clinically. So the specialist would have had to do certain examinations in their room which would indicate the presence of radiculopathy. So we need to double check what is the definition and does the individual comply. And you also need to be aware of the words and or, because some definitions require both and some may require only one. As it's a very old policy, non-disclosure would not really be a consideration unless it was something obvious that came through in the assessment of the claim. Then you would need to explore it in line with your company's philosophy. With regards to an occupational disability case study, we looked at a 59-year-old male. The policy started in 2005. He was a building contractor with an electrical qualification, doing 40% admin, 40% manual, and 20% supervisory work. And he had cervical osteoarthritis for the past 5 years. So the criteria for payout of this particular benefit was for own occupation disability. So this means that if he cannot do the job that he is insured to do, we would make payment of the claim. In this instance, we cannot look at his education and training and try and get him to do another similar occupation, because he's paid the premium for the benefit to say, if I cannot do my exact occupation, then I will receive a claim payout. So the first consideration is that he's had the condition for the past 5 years. What has suddenly changed now? Why can't he do his occupation now? So the first thing to do, because many insurers, especially with old policies, did not get fully detailed job descriptions. So you would maybe have a bit of an idea of what he does, but you would be unable to list his exact job duties on a daily basis. So the first point of call is to get a job description of exactly his day-to-day role and exactly what duties he does. And then you would obviously need medical reports. He's likely seeing an orthopedic surgeon, a neurologist or neurosurgeon, or both. And sometimes it's helpful to get an activity diary to see what is the client able to do on a daily basis. Is he an active coper or a passive coper? Is he trying to, perform exercises, have rehab, do physical therapy? What is his return to work plan? And I think we forget to ask clients and include them in their return to work plan. We rather rely on these medicals. And because occupational disability is so multidisciplinary and multifaceted, we need to find out exactly the circumstances surrounding each individual. Is he motivated to return to work? What is his plans for the future? So once we have all this, we can create the picture and the story and be comfortable in assessing the claim. But based on face value, you would think somebody with a neck condition who maybe can't do 40% manual work, that is quite a lot. But we don't know exactly what this person can actually do. So the assessment for occupational disability is a lot more involved, and we need a lot more requirements. So it's important to even discuss these cases amongst your peers or amongst any specialists you have around you to come to the right decision. And lastly, I want to talk about his age, being 59. You need to look at when the benefit would expire. So is the benefit going to expire at 60 or 65? Is the claim now coming in at this point in time because the benefit's going to expire and this individual thinks this is a retirement benefit? We need to find out what these intentions are, and at the same time be empathetic and realize that, this individual is currently unable to work and it could be a valid claim. And lastly, what I want to touch on is an income protection case study. It's important to note that a lot of individuals have multiple benefits on their policies, and you might be assessing these claims concurrently. So you need to be careful in terms of your decisions, because if, for example, you admit the lump sum occupational disability claim, that individual might believe that you are liable until the end of the policy to pay their monthly income. And I think sometimes these are not always parallel, and we need to be mindful of this and the message that we're giving to the client. For the income protection example, we have a 40-year-old female whose policy commenced in 2018, so a very recent policy. She's been booked off for 3 months, and she has a 1-month waiting period. She's a personal assistant. She has neck pathology and failed surgery syndrome. So the first thing to realize is, because the policy is very new, we have to do a non-disclosure investigation. We need to, depending on your company's philosophy, perhaps request proof of income and also proof of loss of income, but obviously that is in line with your rules of your benefits. And then you need to have the medical certificates booking the client off work. Is the period off work reasonable for the condition? And what is her return to work plan? You can already see some yellow flags arising from this claim because she's already had failed surgery syndrome. That's never a positive thing that her surgery didn't work out. So we could be dealing with a psychological aspect. It doesn't mean that it's necessarily there, but these are the things you need to start thinking about in terms of the assessment of the claim. And once you get all medical reports, you could decide to admit the claim. It's important to note that if everything complies, you can admit the claim for a short period of time. However, you need to case manage this very carefully. As this is a young woman, we would like to try and get her back to work as soon as possible, and we need to take all factors into consideration, not only of the medical condition, but of her mental status, and determine if there's any psychological overlays present. And we need to deal with those separately. Obviously, we need to be guided by her treating doctor and see exactly what we can do to manage the claim and finalize the decision while actively being in contact with the client. So just some take-home messages in terms of claims assessment. There's no real recipe in terms of how we assess a claim. What I've given you today is just a general guideline of what you can use to assess different claims and different benefits. But I think the most important thing is that if you're uncertain, it's important to do research and ask questions, because these claims are not always very simple. Some are simpler than others in terms of benefit definitions, and others are all-encompassing, like the occupational disability claim that we discussed. We need to understand the medical terminology so we know what we're dealing with and that we understand what's written in the medical reports, and also so that we don't call for unnecessary requirements. And then I think it's important to trust your gut. If something does not make sense, you need to question it. And on very complicated claims that are really subjective, you might want to consider surveillance or, something extra to ensure that you're making the right decision on the claim. Case management, although it's a very broad term, we want to obviously manage the claim and ensure earliest possible return to work for the benefit of the client, society, and the economy as a whole. And we want to also look at the bigger picture, ensure we tell the story and we have a clear timeline, and be mindful that this is a client. We need to have empathy. We need to deal with them as such. Even though we don't see the clients often, we look at paper and we make the decision. In terms of the human aspect, it's important to make the clients feel that there's a person at the end of the line dealing with their claim, and rest assured we'll give the best decision possible.